Welcome to the Dr. Lamb Show. Today we have Dr. Jessica Drummond, who is a physical therapist and certified health coach, CEO of the Integrative Women's Health Institute, and best-selling author of two books, Outsmart Endometriosis and Clinician to Coach. She has over 20 years of experience with women, helping women with chronic pelvic pain and endometriosis. And she lives in Connecticut, but she has a lot of help that she does a lot of help through Texas. And so her practice is all over the nation. And so we're so excited to be able to talk to her today about endometriosis, getting to the root cause, and chronic pelvic pain. So welcome, Jessica.
Thank you. Thanks so much for having me.
For sure. So tell us about your journey, with integrative medicine, how you got here, and why you're so passionate about doing what you do.
Yeah, so I started my career just about 20, a little more than 20 years ago as a physical therapist. And I was an athlete as a kid, so I always thought I would go into orthopedics. And I did start there, orthopedics, manual therapy. But I pretty quickly began to specialize, and women's health and physical therapy is essentially specialized orthopedics in pregnancy, shoulder issues related to breast cancer surgery, pelvic pain, urinary incontinence, pelvic floor issues. And so over time, I became more and more specialized in that area of women's health. And my clients that were most challenging were clinically were women that were struggling with chronic pelvic pain conditions, endometriosis, period pain, interstitial cystitis, other bladder pain syndromes, constipation, things like that.
Hmm. Hmm.
And, at the time, the surgeries for endometriosis were not very good. Women were having 12, 16, 20 surgeries in a lifetime, way too many.
Yes.
There was not really a lot of good tools. The doctors were prescribing a lot of opioids at the time. So women were getting addicted. They didn't have any other pain management options. Our physical therapy tools were good, but sort of would hit the wall in
Hmm.
many cases. I saw a lot of women with implanted stimulators and things that just didn't work and often made things worse. So sometime into that journey, I had a child of my own. So I was postpartum and
Okay.
uh, not feeling very well. And I learned later I was very fatigued. I had a lot of anxiety, and it's tricky because it was my first baby and everyone was kind of like, oh, you're supposed to be exhausted like forever once you have a kid.
Yes,
I was like,
yes.
really? I was like perfectly fine like a few weeks ago.
Hmm.
So, and what I think happened, knowing so much more now, was that I had a reactivation of Epstein-Barr virus. I had mono as a kid, and had essentially, HPA axis dysregulation, adrenal fatigue, whatever you want to call
Hmm.
it.
Hmm.
So I was really tired and got every cold and flu and chronic sinus infections, and not tired, just sleepy tired, but like fatigue, deep fatigue. And this went on a long time because this was back in 2003 to about 2006. And, you know, functional medicine really didn't exist.
Yes.
But I did find a integrated practitioner who was one of the earliest functional medicine physicians who I had worked with in Texas when we would send her our sort of like difficult clients, right? And
Hmm.
I was like, I'm a difficult client right now. I'm a difficult patient. I'm going to go see Dr. Nellie Gross. And I think she's still in practice today. I haven't seen her in a few years, but
Awesome.
she and her husband, her son do Chinese medicine and integrative practice and sort of the earliest versions of functional medicine. And the bottom line was I had to reevaluate my relationship to work, to stress. I had to change my diet to be much more nutrient dense. I had to sleep a heck of a lot more. I had to stop exercising so intensely. I had to stop exercising entirely for a
Yes.
couple of years. And over time, though, I was healthier so that was around my early 30s. I was healthier in my late 30s than I had been in my 20s. So I went back to school and got a doctorate in clinical nutrition. And over the most recent 10, 12 years, my practice has sort of integrated that early experience with pelvic floor specialty and women's health specialty
Mm,
physical therapy with bringing in a functional nutrition, lifestyle
yeah.
medicine, health coaching approach, knowing, our pain science has evolved so much in that time as well,
Yes.
that, chronic pain really is a brain injury, if you will.
Mhm.
And so the more that systemically we could lower inflammation and improve brain health, that could help us really support the system to heal from the symptoms of endometriosis. While we can't necessarily reverse the disease, having women, go through much better, higher skilled excision surgery as once, maybe twice, not 12, 16 times. And
Mhm.
then the system is both prepared for that surgery, recovers better from that surgery, and then women have tools to really keep their symptoms very low through their lifetime.
Yeah, I love all that you're talking about. That really endometriosis, we tend to think, oh, it's just a hormonal issue or a pelvic pain structural, something structural is going on. But no, like you're saying, it's a whole body hormone balancing, adrenals coming into it too, stress levels, and even making sure maybe, yeah, the gut, the immune system, everything
Mm.
is very in balance when you are dealing with the endometriosis. So that's really nice to hear you have that personal experience, and that's how you're helping people now to really get better their whole system, right? And yeah, I like that you bring up adrenal fatigue because that's mainly what we deal with, a lot of
Mm.
these fatigued patients. So yes, we definitely see a lot of women also go through endometriosis, and nowadays it is better to try to prevent as much surgeries, right? Because that's not the fix. It's more of a band-aid that they think that it's going to help, but they end up coming out of surgery and they don't feel better, right? That's a lot of times that's what you've seen. So kind of tell us a little more about this endometriosis, the type of patients that you see, and how you can get them through their chronic pelvic pain.
Yeah. So, endometriosis is very common. 1 in 10 people with uteruses have endometriosis. So that's 176 million people in the
Lots.
US, in the world.
Yeah.
So that's a lot. And so we have to, I really think, and some of the great organizations that work in endometriosis, such as the nonprofit Endo What, and others, are beginning to educate school nurses, pediatricians, gynecologists, because endometriosis generally presents, it's something you have at birth. It's a partially genetic disease. And then how it expresses normally begins to present in pre-puberty. Most of the time it's missed at that point because it looks like digestive issues or bloating or weight gain or something like that, or fatigue. Then later it might be presented as something like maybe this could be endometriosis when there's period and pain involved. However, with adolescents, the pain isn't usually cyclical because, of course, the cycle itself is not established. So the pain can be more random, it can be constant, it can be intermittent, but not necessarily in alignment with the cycle. But endometriosis is the number one reason that girls miss middle school or high school because they have such severe pain. They can't, show up for their tests and their softball practice and all the things that they're trying to do. So endometriosis takes young women, girls and young women, kind of off their career path.
Mhm.
74% of women with endometriosis say that they've kind of had to take a life detour because they couldn't, keep showing up at the level that they wanted to. And many of my patients have pushed through that and have, big careers and things like that. But there's a point where they just can't sustain the energy they need to show up at that very high level of pain.
Mm.
So now, not everyone with endometriosis has constant high pain. In some women, it's actually silent and they don't even know they have endometriosis until they're struggling with fertility.
Yeah.
Um, so those are the most common times that women become aware. And, in traditional gynecology offices, it's very common still for women to just be put on hormonal birth control. Oh, well, let's just quiet it down. But that's not really what we want to do. We have to think of endometriosis as like a three-pronged disease. One, it has a genetic underpinning. So we want to increase the index of suspicion if there's family members with endometriosis or infertility or bad periods. The hard part is that this is one of those things that's not really well talked about. And it can actually make it worse in some ways in terms of diagnostic delay, because it's like, oh, all the women in our family have this horrible period, like welcome to the club. Not really, it's not normal.
Yes, yes,
it's just common in your family.
yes.
So just because other women have dealt with this in your family, you still should seek treatment. So there's that genetic underpinning. It's an inflammatory condition, and there's an autoimmune component. So the lesions themselves, so endometriosis, literally there are these growths that are non-cancerous, but they are certainly life-altering. And they're made of tissue that's similar to, but not exactly the same as the lining inside the uterus, which is why it's called endometriosis. That's the word is endometrium, but
Mm-hmm.
it's not exactly the same tissue histologically, but whoever discovered it however long ago, that's what they called it.
Yes.
So these lesions, which can be hormonally driven, they actually, many of them produce their own hormones. We used to think it was an issue of estrogen dominance, but in 2018, we learned that that's not actually true. These lesions can have upregulation of estrogen receptors. They can have upregulation of progesterone receptors, both or neither. So we actually we want to optimize like hormone balance in general, just so that women are generally healthy through their endometriosis, but manipulating the hormones doesn't always do anything, which is why 30% of women might be helped by being on birth control, because you're essentially suppressing estrogen. So you'll kind of quiet the symptoms for a while, but
Mm-hmm.
it doesn't cure the endometriosis.
Mm-hmm.
So, and in fact, it kind of puts a Band-Aid on it that can prolong fertility issues and things like that. Now, there are rare cases, not rare, there are some cases where hormonal suppression as a part of the overall strategy for a period of time to manage symptoms is a reasonable thing to consider. But treatment with hormonal suppression, even if it's just birth control, is not really getting to the root cause. So
Right.
we want healthy hormone levels, but we can't really cure
Mm-hmm.
endometriosis in any way by changing hormone levels. And because these different kind of lesions can be all in the same woman, and you're not going to know what those lesions are unless
Mm-hmm.
the surgeon actually removes them and does histology. So by then it's too late. It doesn't matter, right?
Right,
So
right.
we just want healthy hormones, but really the things we want to focus on is immune health and
Mm-hmm.
digestive health, because the digestive and immune systems are so intricately linked. And
Mm-hmm.
even beneath that, the nervous system,
Yes.
especially the autonomic nervous system.
Ah,
So lowering inflammation and optimizing immune health is really what we do to help women prepare their bodies for skilled excision surgery if they decide to go that route, if it's appropriate for them. There are more and more very skilled surgeons who, while they might be trained as gynecologists, they're not like sort of part-time delivering babies, occasionally doing endosurgery. Like this is their life's
specific.
work.
Yeah,
Yeah,
their
they're really
specialty. Uh-huh.
trained. And that's what you want for this. It's as important, I think, honestly, as choosing your cancer surgeon. Like if you're going to choose surgery in endometriosis, you want to choose someone who's specialized.
Right.
And then, but before you go into that surgery, because it isn't generally, I mean, there are cases where it's an emergency surgery, but most of the time it's elective in the sense that you can plan when you have it.
Mm-hmm.
It's ideal if you take 3, 4, 6 months prior to really get your body healthy, lower your inflammation, balance your hormones,
Mm-hmm.
optimize your immune health, optimize your digestive health, get plenty of nutrients in so you have a lot of resilience for the surgery. And then recovery from surgery will be easier. And you can have a plan for that too, how to recover the inflammation and get rest, get
That
more
sounds
rest and
good.
all of that. So that's our approach, is really taking, you know, sometimes surgery can be super, super valuable in this population, but we don't want to just do that in a vacuum with
Right
someone
away.
who's
Yeah.
been struggling for, a decade.
Hmm. Like, because you like you said, they can always come back if you're not really getting to the root cause, right? And you're talking about the three prongs, so let's just reiterate that. So was it the immune, the inflammation that you're talking about?
Mhm.
And then the gut?
Inflammation, yeah. So inflammation, autoimmunity, um, and genetics, which you can't really alter, but you can alter inflammation and immune health
Hmm.
through the digestive, immune, and nervous
Yes.
systems. So those
Yes.
are the systems that we're focused on. And sometimes the pain drivers aren't even really directly related to the endometriosis lesions. So it's also very important to have a pelvic physical therapist on board. While
Yeah.
I'm not really hands-on in the clinic much anymore, I still have
Yeah.
my pelvis. And
I was gonna ask, how do you do to your telehealth with being a physical therapist? Because you think like you need to go see someone for physical therapy. Yeah.
yeah, I mean, generally so, although there's a lot you can do, once you understand your own pelvic floor. This is your pelvic floor. So here are your sitting bones, and here's
Hmm.
your vaginal opening and rectal opening. There are lots of muscles here.
Hmm.
So this is the analogy I like to use. So imagine like you're walking down the street one day and like a branch falls on you and you get a cut on your shoulder.
Hmm.
Well, that's fine. But imagine that doesn't heal for like a year or 2 years or 6 years, right? You're going to kind of tense up your shoulder and your neck, and you might start having chronic headaches and maybe arm pain and shoulder issues. It's not because there were like problems with all those musculoskeletal problems. It's because your body was kind of protecting the injury right there.
Hmm.
So if you have endometriosis lesions on your bowel, around your reproductive organs, you might have in the muscles and nervous system and joints of the pelvic floor and hips and back and legs some protective tension that can cause a lot of pain. It can cause sexual dysfunction. It can cause urinary issues, can cause chronic pain. It can cause period pain. So, pelvic physical therapists should also be a part of that team. And while I don't do a lot of that, you can do some of this with telehealth, but ideally now that things are safer
Finding
enough,
someone
yeah, it's best to to
locally,
to work with someone locally.
like a
Absolutely. And
woman's health PT, or
mhm.
what do you recommend? What
Yeah,
does it call?
you would search for a women's health physical therapist, pelvicrehab.com, pelvicguru.com, or the American Physical Therapy Association has a Academy of Pelvic Health. So that's what you're looking for, and talk to them, because certainly, just like with everything else, some pelvic health physical therapists specialize more in incontinence, or some specialize more in osteoporosis. Ideally, you want someone who works with a lot of chronic pain.
Mm. Yeah, so not only the immune and the gut, but also structurally, right? Like you're
Yeah.
saying, you need someone to loosen those muscles up that have been tensed for a long time. But I'm sure that you also recommend, I know it's very person dependent, but are there just in general good exercises for these chronic pelvic pain women, or people who have endometriosis that they can do at home to try? What do you
Yeah,
recommend?
I mean, you can certainly start with diaphragmatic breathing, pelvic floor relaxation. So you don't want to do a lot of kind of hardcore kegels. Like, you want to do almost the opposite of that. You want to just relax the muscles of the pelvic floor. You can use wands and dilators. There are tools you can use to kind of gently stretch the muscles of the pelvic floor. Things like butterfly stretch. You can put a block between your heels if you're sitting up with like your feet together, and just kind of stretch your heels apart. That can
Mhm.
stretch those sitting bones apart slightly.
Mm.
Gentle squatting position. There's a lot of one of our students at the Integrative Women's Health Institute. Her name is Brianne Grogan. She talks more about prolapse, but she has a lot of great videos on YouTube under Fem Fusion Fitness for kind of more of this down training. It's almost the opposite of strengthening those muscles. We want to teach them to relax, stretch, and the abdomen, the back, the hips can also be involved. So we want to strengthen your hips and legs so that you're not overusing the pelvic floor when you're, lifting your kids off the floor or things
Hmm.
like that.
Yeah, no, that's great. Great tips for gentle stretches, more like relaxation, right? Not
Yeah.
not very intense, because a lot of times these women have already been through a lot of intensity exercises or surgeries, and so they might have a lot of scarring too, right?
Yeah,
Um,
definitely more relaxation. Yeah.
Good, good. And then, so I love that you talk about decreasing inflammation. Any general tips for that, for specifically for women with endometriosis?
Yeah, so there's no sort of endometriosis diet, but for each of our clients, we do optimize their personal anti inflammatory diet depending on their genetics, depending on what other things are going on, if they have bladder involvement, if they have constipation. The first thing we really have to do is make sure we're optimizing digestive function, good hydration, fiber, good gut motility, which can be helped with physical therapy, but also with supplements like ginger and artichoke and, digestive support, lots of chewing, making sure that you're eating in a calm way. So many
Mm,
women are eating so stressed that they actually aren't digesting well because you can't be in, fight or flight
mm-hmm,
and rest and digest at the same time.
mm-hmm,
So, a lot of our biggest challenge is helping women create the space for relaxation and healing and eating more slowly, less inflammatory foods, lots of fruits and vegetables, not fruit necessarily, because there can be some yeast issues involved, but vegetables mostly cooked at the beginning so they're easy to digest, broths, high quality proteins, good healthy fats, nuts, seeds, avocados, olive oil is fantastic. And a lot of times for our clients, it's about adding nutrients because when it hurts to eat, it can be more and more restrictive. But to
mm-hmm.
me, if you have pain or digestive symptoms, that's a sign of a nervous system issue, not a food sensitivity. So we have to be mindful. Now, certainly there are people who have food allergens, and we don't want to eat a lot of, we don't want to live on processed grains and sugar,
Mm-hmm.
but we want to have a nutrient dense diet. But we want to think about if we're having symptoms related to either the pelvic pain of endometriosis or digestive symptoms, think back to the nervous system. How much time during the day are you in that recovery mode versus that stress mode?
Mm. So nervous system, what do you normally do for that? Is it breathing, stress reduction, meditation? What?
Yeah, all of that, anything that works, breath work, mindfulness practices. It's about the space and commitment for most people. Walks in nature. If you think about animals, I was talking to one of my clients the other day about her. She has a Labrador that kind of hangs out with her in the office.
Yeah,
Your Labrador dog is going to land in the sun 90% of the day. And then
yeah.
occasionally go for a sprint and chase after a rabbit and do whatever. We are animals and should be functioning more like Labradors, but we're like chasing after rabbits like 95% of the day
So
and laying in the
true.
sun like 1% of the day.
Wow, you're
so,
right.
so flipping that is a huge task. Most women can't just flip that on a dime. Most humans can't flip that
Hmm.
on a dime.
Hmm.
But we can start to think that way. What would it look like if right now, first of all, I just create space for mindfulness and rest? 10 minutes every 2 hours or 20 minutes a day. Like, let's start with something that's manageable depending on what someone's doing.
Hmm.
Then, more than that, how can I bring this sense of calm into everything I'm doing? How can I enjoy every bite of food more? How can I, just do things a little bit more slowly and relaxed and with pleasure? And there's a lot of resistance to that because we're really taught from a very young
Society.
age that like,
Yes.
yeah, like you have to be achieving and you've got to do this right and you've got to do it faster and you have to do
Mhm.
400 things at the same time. I was actually reading, my oldest daughter is preparing, she's a junior in high school. So we're starting to think about like getting ready for college, and she's on all these college sites. And this morning I was scrolling Instagram, and this set of twins wins like $24 million in, scholarships and got into 100 colleges. And they're like, we were on 40 clubs. And I was like,
Oh,
we
wow.
start this so young.
Yes.
My 10-year-old decided earlier this year she wanted to play the bass, which is like a huge
Mm.
instrument,
Yeah.
which
That's
is funny
exciting.
because my whole family is like super short. And so, but fine. So we get this email, like she's going into 6th grade, so middle school music. Now, of course, everyone's been schooling at home half the time, and it's just kind
Yes.
of a mess anyway. And they're like, well, she can be in band or she can be in the chorus. It's like, it's too late for her to join the orchestra. Like, she's too old. And I'm like, no. I'm like,
What?
she's 10. Like, she can't have had a whole violin career
At
under
age
her
4.
belt by now. It's crazy. It's really crazy. So we have to unwind some of that programming, because truly, that is the most important thing. I've been working with women with chronic illness, chronic pain for 20 plus years.
Mhm.
And I really understand now that it's very hard to heal when you're living in a chronic state of perfectionism, fight or flight, type
Yes.
A-ness.
Yes.
So we have to create that space. Then the food part gets easier. Now, nutrition is really valuable because nutrition supplies polyphenols and anti-inflammatory nutrients and proteins to help balance the brain neurotransmitters and all this stuff.
Right.
But we can't even enjoy it and absorb it if we're living in that
Yeah.
upregulation.
That's so true. You digest your food, but you also digest your thoughts, right? It's all part of the digestive process. And so it's very important to have all parts be equal and be worked upon, because not everybody will have perfect all three prongs of the stool, like you talked about. So
Yeah, and
I,
it never will be perfect,
right. Yeah.
because we just can't control all of it, right? Even if we
Yeah.
really wanted it to be perfect, like anything could
Life
happen.
happens.
You could just get in a car accident on the way home, right? Like something
Yes.
could happen. So instead of thinking about doing it right, just leaning into all of those things, right? The calm nervous system, more nature time, more
Hmm.
nutrients, adding more healing,
Hmm.
what we call in pain science, signals of safety.
Mm.
So the more the brain feels safe, and you can't just tell someone like, hey, you're safe. They have to subconsciously feel safe. And the brain will subconsciously feel safe when you're doing things to tell it it's safe. Like just literally breathing slower, enjoying your life, eating food
Positive
that tastes
thoughts.
delicious,
Yes. Hmm. Hmm.
positive thinking practices, surrounding yourself with positive people, turning off the more negative stressors that are unnecessary. There are certain stressors that
Hmm.
you have, but we don't all have to listen to 24/7 news all the time or ever.
That's true. Hmm.
So we can turn off some of that.
Yes, yes, we definitely can. And lays around like that Labrador, you know, give ourselves and not feel guilty about it. I think a lot of
Mhm.
times we just feel, oh man, I should be doing this, I should be doing this because of the societal pressures that we have to be successful by this time and age or things like that. And so, giving, I love the idea that you said about giving yourself the space and to be able to forgive yourself, if you can't be perfect, because no one is perfect, right? And you
Yeah.
deal with it. And this helps not only with pelvic pain, but yeah, like you said, like adrenal fatigue, hormone balancing, your gut, your immune system, your whole nervous system. So, um, thank you so much for talking to us. That I learned a lot, and I hope all our listeners have really learned a lot about, the endometriosis, the pathways of how you can help it, reducing inflammation, getting to the root cause, helping your whole system, not just focusing on band-aid treatments, right?
Yeah, for sure.
Anything else? Oh, so if people wanted to get a hold of you, what would be the best way if you have some handles or is a website?
Yeah. So my website is integrativewomenshealthinstitute.com. And you can visit us on Instagram at Integrative Women's Health. And I'm happy to give anyone listening to this podcast a free copy of my book, Outsmart Endometriosis.
Yeah, awesome.
Just go to outsmartendo.com.
Okay, that's really great. And you also do a lot of consultations, right?
Mhm.
More teleconsultations for people who might be listening and they're still dealing with their pelvic pain and they don't know what to do. They can just reach out to you. So thank you so much, Dr. Jessica Drummond, for being on our Dr. Lamb show today. And I invite everyone to like, subscribe, and hit the notification bell so that we can listen to these weekly podcasts. Have a good day.
Thank you. Thank you.
Thank you.